Ramsay-Hunt syndrome. This is a concise presentation for medical student. It is also known as Hunt syndrome, or herpes zoster oticus. Ramsay-Hunt syndrome is a painful rash around the ear, on the face, or on the mouth. It occurs when the varicella zoster virus infects a nerve in the head. Let's see the causes. The varicella zoster virus is causative agent for Ramsay-Hunt syndrome. It can occur in people who have had chickenpox. Once you recover from chickenpox, the virus stays in your body, sometimes reactivating in later years to cause shingles, a painful rash with fluid-filled blisters. It is the same virus that causes chickenpox and shingles. In people with this syndrome, the virus is believed to infect the facial nerve near the inner ear. This leads to irritation and swelling of the nerve. The condition mainly affects adults. In rare cases, it is seen in children. Signs and symptoms include: the two main signs and symptoms of Ramsay-Hunt syndrome are a painful red rash with fluid-filled blisters on, in and around one ear, and facial weakness or paralysis on the same side as the affected ear. Patient might also experience ringing in your ears, tinnitus, severe pain in the ear, hearing loss on one side, vertigo, weakness on one side of the face that causes difficulty closing one eye, food falls out of the weak corner of the mouth, as well as facial droop and paralysis on one side of the face. Now let's see the risk factor. Ramsay-Hunt syndrome can occur in anyone who has had chickenpox. It's more common in older adults, it is rare in children. And it is not contagious disease. Anyone who has a weak immune system, newborns and pregnant women are at risk. Complication may include permanent hearing loss and facial weakness, eye damage. Ramsay-Hunt syndrome causes facial weakness which lead to difficulty in closing eyelid and cornea become damaged. Postherpetic neuralgias also occurred. Proceed further with diagnosis. It is usually diagnosed by looking for signs of weakness in the face and a blister-like rash. Diagnostic test may include blood tests for varicella zoster virus, electromyography to evaluate the response of muscle against nerve stimulation, lumbar puncture, MRI of the head and nerve conduction, to determine the amount of damage to the facial nerve. Now let's see the treatment. Strong anti-inflammatory drugs called steroids, such as prednisone, are usually given. Antiviral medicines, such as acyclovir or valacyclovir, may be given. Sometimes strong painkillers are also needed if the pain continues even with steroids. Wear an eye patch to prevent injury to the cornea, corneal abrasion, and other damage to the eye if the eye does not close completely. Thank you for watching.